Arthritic pain in runners is something that causes a lot of runners a lot of distress and confusion. Today, we're going to try and unpack arthritic pain in runners. What does it feel like? What does it mean? What should you do about it? And see if we can't exercise a little bit of clearer judgment on exactly what this means for your running future. So first off, what are we talking about here? So arthritis or osteoarthritis is, unfortunately, I don't like the word, but this is what it is. It's degeneration of the joint, and it happens as we age, but it's not the normal aging process quite. It is usually more pronounced. It is more uneven rather than a generalized, subtle wear and tear of the joint. As we age, it's much more pronounced in certain regions of the joint where you'll get thinning of the cartilage, even to the degree where you get exposure of the underlying bone bruising, and other such things. And then you'll get bony outgrowths of osteophytes and these kinds of things. The joint capsule will swell. And these are the things that cause the stiffness, the pain, and the generalized problems that you get with arthritis. Now, arthritic pain is different from other kinds of pain. So when we have pain associated with those changes in our joint, then it will tend to feel a certain way. It'll tend to feel quite diffuse or vague or generalized. It's not very specific to a specific location. It feels kind of general. It can sometimes be difficult to describe. Say if it's in your knee, you might say it's more around the inside or it's more around the front, but it's not exactly clear exactly where the pain is. Same with the hip. Sometimes people say it's like it's deep within the hip kind of thing. So it's a very generalized, diffuse kind of pain. It's quite achy pain rather than sharp usually. It tends to get worse as we're going. If we're running more, it'll get worse. And often it'll be worse afterwards. So that latent pain that we talk about sometimes, which is where you get pain more so that evening or the following morning, that can be quite pronounced often when the pain is due to arthritic change. Now, the difficulties with arthritic pain start to come in the variety of presentations that you can have, because you can have pain associated with arthritis that is coming from a very, very mildly arthritic joint that is giving very, very mild symptoms. So that might mean that you only get knee pain from arthritis on a long run once or twice a year, and it's barely a problem at all. And this can range right through the spectrum to the other end, where someone else with knee arthritis and pain might be completely unable to run, completely unable to do stairs or walk for long distances, unable to get in and out of a chair, and sometimes even unable to sleep, to the point where their life is completely almost ruined by the degree of arthritis that they have in their joint, and everything in between. So to say I have arthritis in my knee doesn't tell us too much. It doesn't tell us much at all about the severity of the condition itself or the symptoms or the disability that is resulting from it. So arthritis pain in runners is not always the same. In some runners, it might be quite significant and quite a severe problem, and others it might be a mild, almost a nuisance of a problem. So it's important to remember that. But in either case, what you should do about it, there are some things that we should always do. And number one, I would say, is if you have arthritis and you have pain from arthritis in your knee or your hip, usually it can be in your ankle or other things, or your spine, then the most important thing that you need to do is to be healthy. The evidence is quite clear that unhealthy sedentary people have worse problems with arthritis as they age than healthy people who are relatively active. So we want to be as healthy as possible, meaning we're eating well, we're not overweight, we're not overstressed. We are exercising in a way that we can do, and we're doing it regularly with some intensity. These are things that will make us as humans healthy. And when we are healthy, our joints will be healthy, including the joint that we have the arthritic change in. And to that point, the second thing that I think is important for people with arthritic pain to do, if possible, is to keep running. And the reason is because runners are generally healthier than non-runners. So if we can avoid becoming a non-runner because of the pain, then we should, because that will keep us healthier. And when we're healthier, our knee will be healthier, which means our life with this arthritic knee or hip will be a better one. We'll have less disability, less pain if we can stay active and healthy, and running as runners is our primary way of doing that. So if we can find a way to keep running, then we should. Now, how do we keep running if we have arthritic pain. And remember, we're talking the spectrum here. This could be a very mild problem that only hurts occasionally and doesn't really limit you. This could be a very severe problem that doesn't let you run at all, okay, and or anything in between. So what do we do about it in any of those situations is the three critical components, okay? So we're going to fix the form, strengthen the structures, build the muscles. These are the things that are going to set us up in the best position possible. So fixing the form is about running, moving, walking in a way that doesn't put undue stress on that knee, in a way that is not biomechanically optimal. So we're trying to move in the best way possible, the most efficient way possible. And then we've got strengthen the structures. So we're going to come back to that in a sec. That's more about like the running and how we engage with that. And then build the muscles is making the muscles as strong as we can so they're better able to support the joint. So we're less likely to have pain when we use the joint. Now, of those, from what I can tell, strength has the best evidence. There's a lot of evidence that shows if you have pain and you have arthritis in the joint, then getting stronger will reduce your pain and increase your function. Whatever degree the issue is, getting stronger does tend to help. So strengthening the muscles, building the muscles up that surround the joint is probably the most important thing that we can do. That being said, strengthening the structures, toughening the structures, making the knee joint that you have, even if it has arthritis in it, as tough, as strong, as resilient as we can. This is the thing that is done worst in my experience, and it tends to be because of the advice that runners get from medical professionals. And this is like the sayings go, if you don't use it, you will lose it. So if you stop running or you run a lot less because you have arthritis and you don't want to cause further damage, you are then no longer stimulating that joint in the way that you used to. And when that stimulus is reduced, the stimulus to adapt is reduced, which means there's less adaptation, which means the joint is not stimulated to adapt and become stronger and tougher and more resilient, which means it will do the opposite. It will become weaker. It will become less resilient. It will become more sensitive. And this is why I always say running is the rehab. And this is another reason why it's so important that if you have arthritis in your knee or your hip and you are able to keep running to some degree, then you should, because chances are if you do it in the right way, so you're not doing too much but not too little, and you're progressing at the right rate and you're listening to your body, using things like the pain traffic lights so you don't go too much too soon, but also you don't stay stuck where you're at being too conservative. If you're doing all those things correctly, the knee will usually get less sensitive. The hip, the ankle, whatever joint we're talking about, it's usually the knee in runners, which is why I keep defaulting to that. But it will get less sensitive through exposure to running. It will also get tougher. The joint cartilage, the bones, they can still adapt. Even if there is arthritic change, they can still become better able to tolerate that stress to a degree. And this is why we want to use running as the rehab, because when we do, if we apply it in the right way and run more at the right rate, the body will tend to adapt. The joint will become stronger and more resilient and able to tolerate more, which will then allow you to do even more. Now, how much and at what rate will depend on all of the other factors, but you don't know, and importantly, nobody else knows and nobody can predict. What we can do is to try and run and train in the adaptive zone. So not too much where we're getting red light pain, not so little where we're not feeling anything and basically just resting and getting weaker. Just the right amount where when we're running and strength training, we're getting some green light pain, some orange light pain. That's going to allow us to engage with our training in our way that our knee, hip, ankle, foot, whatever it is that has the arthritis in, can actually adapt to, become stronger and more resilient. Then we're going to progress that at the rate that our body seems to be able to tolerate it, using those same things to measure it. Green, orange, and red on your workouts. How is it doing? Is it tolerating it well? And then we're going to keep going. So every week we're trying to do a little bit more. If we think we can go faster, looking at how the body's responding, we will. If we have to slow down, we slow down. And what we do is we keep going until the body doesn't seem to be able to get any higher. So you're at a training load, a training volume and intensity that you seem to be able to tolerate. But if you try and do more, in spite of doing everything right, as we've just talked about, so you've got good biomechanics, you're doing really good strength training, you're being very specific, and careful is not the right word, you're being very specific and deliberate in your running training. When you're doing all of those things correctly, and you have guidance from an expert, especially who's done this a lot of times before, if you hit a ceiling where you can't seem to do any more, it may be that you have to stay there. That ceiling might be doing 2 or 3 marathons a year. It might be running, walking for 5 kilometers once or twice a week. Like, we don't know until you start to go through that process and see where you end up. And it's going to take you a few months to figure that out. And again, it's going to be easier if you have someone to help you with that. But what you shouldn't do is make that decision in advance until you've gone through that process to see how far you can get with this joint and what it's capable of in the right circumstances. You shouldn't make decisions to stop running or to go for surgery or have injections or any other form of care that would be based more on making the best of the situation that you're in. We want to look at making it better first, see how good we can make it, and then decide what we want to do from there. And if you would like help with that, you are more likely to make good progress if you're working with a team of experts like us who've done this hundreds of times before. So you would like our help with that, and you have arthritis, you have pain, and you still want to run, or you want to run more, you want to set yourself up in a way where you can keep running for the long term without doing yourself any harm, then obviously we want to talk to you. Just click the link in the description as usual to book a call. We'll have a chat and see where you're at and see if we might be able to help you.